এক পা চলে খোকা, এক পা চলে খোকা, নতুন আলোর দিগন্তে, মায়ের বুকে জাগে আশা, কোন সে মনের অজান্তে। মা মা এক পা চলে খোকা, নতুন আলোর দিগন্তে।
Is a complex brain disorder. And the reason it's complex is because it affects all of the different parts of the brain. Now, because it affects all the different parts of the brain, you see all different kinds of problems. Children that would develop normally would develop normal speech, but children with autism don't develop normal speech. The brain disorder is so pervasive that it causes a lot of confusion. So when a child is in a situation, they have a tendency only to focus on one thing. Usually the thing that they focus on is not very important. They have a tendency to pick up objects and play with objects in a weird way, not a typical way. For example, this is a pen. It has a certain type of use, a certain way you hold it and you manipulate it. But they would play with the pen and look at lights and make noises with it and see how it affects their vision in a very peculiar, difficult to understand kind of a way. If you look at any section of the cortex of the brain, the outer layer of the brain, and you compare it to a neurotypical person. A neurotypical person is a person with no central nervous system problem, no brain problem. When information gets to the cortex, we see that information can go in and come out very quickly. And the reason is because all of the cells are in straight lines, and all of the cells are touching each other. They're symmetrically aligned, and they all have the same density, the same thickness. A person with autism does not have the same cellular structure as a neurotypical person. What we find when we look at the cortex is different size cells, different density cells, and things are not in straight lines. So what happens is when information comes in, it's not being processed effectively, and that lack of processing causes the disorganization. In the typical brain, when information comes in, goes through the processing center and is then sent out, sometimes information needs to be shared with other centers of the brain as well before it then comes out and goes into an action or a performance of a behavior. In the autistic brain, because of this lack of symmetry and the inability to be processed, two things happen. One, it doesn't go to the other centers of the brain in order to help in the processing. And two, it kind of like gets lost. It just keeps going around and never gets processed. And that contributes to the ongoing frustration of the child because they are smart enough to know that nothing is being done. This problem exists in the frontal lobe, in the parietal lobe, the sensory lobe, occipital, temporal, and cerebellar lobes. So it's a global issue with regard to the brain. So processing of information is not happening. It's not typical mental retardation. The child understands something's broken. The child understands his brain's not working. That's when they get confused. That's when they get very angry and they try and get their brain to work by banging. Even though you have all of this disorganization going on, the child with autism can in fact learn. The child with autism can acquire social skills, eye contact, language, fine motor, gross motor, and activities of daily living skills sufficient enough to get along with their peers and go to school. And we even have children going to college and getting very good jobs. The trick is to get the child to calm down enough in order to then figure out how to process, in order to do therapy with the therapist, to do therapy on themselves so that they can then acquire the skills necessary. What we know is that sometimes these children can process certain kinds of information better than anyone we know. In fact, some children with autism are considered geniuses because they can take certain kinds of information, process it faster and better than anyone.